Welcome to Shanu Media Education. Today I am going to the taking the important multiple choice questions related to the TSPSC, AIIMS and NORCET and JIPMER who are preparing the central government jobs and along with state government jobs. It is very important questions that are who are, that is came previous question paper. I have taken that important questions and I have brief explanation I have given in this video. Mostly you should watch the complete video and like and share this video. Okay, today the question number is which of the following is the most commonest surgical procedure for the chronic otitis media? Option A myoperiectomy, option B osteocloplasty, and option C is mastectomy. Option D is the tympanoplasty. The answer is the option D is tympanoplasty is involved in the surgical reconstruction as the tympanic membrane, and it is done in re-establishment of the middle ear function, close performance of the prevention of the recurrent infection. The question number two is the nurse is writing in the teaching plan for the client undergoing the radioactive iodine uptake test to the study thyroid function test. Which of the following the instructions should be the nurse include? The option is you need to stay at least 4 feet distance from the other people after the test because you will radioactive. The option B is you need to lie very still on the stretcher that is placed in the long tube for the scan. The option C is schedule the bone scans before your radioactive iodine uptake test. The option D is don't take any iodine or thyroid medication before the test. The option D is don't take any iodine and before thyroid medication of the test. The question number three is when does HCG level reach as a peak in the normal pregnancy? The option is 20 to 30 days. The option B is 30 to 40 days. Option D is C is 100 to 110 days. The option D is 60 to 70 days. The option D is 60 to 70 days. Question number 4. Retain the succionate lobe of the placenta may lead to. The option is secondary PPH. The option B is subovulation. Option C is sepsis. The option D is all of the above. The option D is all of the above. The question number 5 is the commonest gynecological cause of retention urine. The option A is hematocolapsus. The option B is vaginal obliterations. The option C is cervical fibroid. The option D is ovarian tumors. The correct answer is option B. The question number C is enterocoli repairs during the abdominal operations is option A is McLeod's repair. Option B is Skirodakis repair. Option C is Killis repair. And option D is Mescowait's repair. The correct answer is option D. Mercochoi's repair. Seventh question is chest compression ventilation ratio in the infant and child CPR with two rescuer is option A 15 is to 1, option B is 30 is to 1, the option C is 30 is to 2, the option D is 15 is to 2. The option D is 15 is to 2. Question number 8 commonest complication of the intrauterine device. The option A is infection, option B is pain, option C is ectopic pregnancy, the option D is bleeding. The correct answer is the option D, that is bleeding. The commonest complication of the uterine device is bleeding is the common cause. The ninth question is the following are the contraindication of the trial labor aspects. Option A, elderly prime. Option B is post maturity. Option C is malpresentation. Option D is first degree CPD. The option D is first degree CPD. Question number 10. Bell plasty is associated with the lesion of option A, 7th cranial nerve. Option B is ninth cranial nerve. Option C is 11th cranial nerve. Option D is 3rd cranial nerve. The correct answer is option A, 7th cranial nerve. The bell plasty associated with the 7th cranial nerve. The 11th question, most important complication of the peritoneal dialysis. Option A, DVT. Option B is diarrhea. Option C is hypertension. Option D is peritonitis. The correct answer is peritonitis. The most important complication of the peritoneal dialysis. The correct answer is peritonitis. The most commonest cause of the chronic asthma. Option A is atelectasis. Option B is pulmonary process. Option C is pneumonia. Option D is emphysema. The correct answer is emphysema. The most common as a chronic asthma is emphysema. Question number 13. The most common cause of the primary hydrocephalus is overproduction of the CSF. The option A. The option B is obstruction of the CSF. So the option C is slow reabsorption. Option D is none of the above. The correct answer is option A, overproduction of the cerebrospinal fluid, the most common of the hydronephrosis. The question number is 14th. Main clinical symptoms of hiatal hernia. Option A, vomiting. Option B is diarrhea. Option C is heartburn. Option D is lower abdominal pain. The correct answer is heartburn. Answer C. The 15th question is most important aspect of the management of the burn injury in 24 hours is option A dressing, option B is antibiotic therapy, option C is fluid resuscitation, and option D is plastic surgery. The correct answer is fluid resuscitation. The most important aspect of the management who are born with the burn injury patients, the most point is to fluid resuscitation. Why? Because in burning time the fluid imbalance is very high in the who are burn patient. So that we do the fluid resuscitation to the patient. The question number is 16. Earliest and commonest clinical feature of the primary biliary cirrhosis. Option A pain. Option B is pruritus. Option C is fever. Option D is jaundice. The correct answer is jaundice. The earliest common clinical feature of the primary biliary cirrhosis is jaundice. Jaundice is the main cause of the biliary cirrhosis. The question number is 17. The respiratory center are the stimulated by option A oxygen, option B is lactic acid, option C is carbon dioxide, option D is calcium. The correct answer is option C carbon dioxide. The carbon dioxide is the respiratory center is stimulated in the stimulated is question number 18. Commonest cause of the cerebral interaction. Option A embolism, option B is venous thrombosis, option C is aneurysm, option D is arterial thrombus. The correct answer is option A. Embolism is the commonest cause of the cerebral infarction. Option number question number is 19th. First most common type of the cancer in the female in India. Vaginal cancer. Option B is breast cancer. Option C is cranial cancer, cervical cancer. Option D is ovarian cancer. The correct answer is option C, cervical cancer. The cervical cancer is the first most common type of the cancer in the female in India. Question number is 20. When is the counting the apical pulse during the physical assessment? It is the most accepted practice for the nurse to count the apical pulse in the which of the following ways. Option A, for 15 seconds for multiply by the 4. Option B is for 30 seconds and multiply by the 2. Option C is for 1 minute checking radial pulse at the same time. Option D for 1 full minute. The correct answer is for 1 full minute for the counting apical pulse during the physical assessment of the most accepted practice. It is the nurse should be count the full 1 minute. The question number is 21. Munson's sign is seen in the option A Morganian contrast, option B is keratoconus, option C is endopathomatitis, option D is trachoma. The correct answer is option B keratoconus. The question number is 22. When teaching someone about endocrine glands, which of the following statements could use? Option A, the endocrine glands include in the sweat and subcutaneous glands. The option B is endocrine glands all have at least one duct. The option C is hormones are carried away from the endocrine gland by the blood. Option D is there is no apical tissue in the endocrine glands. The correct answer is option C. Hormones are carried away from the endocrine glands by the blood. The question number is 23. Chlor coding for nitrous oxide cylinders is the option A is black, the option B is black with white shoulders, the option C is French blue, option D is grey. The option D is grey. The question number is 24. When helping a client who is the recovering from a stroke to walk in, the nurse aid should be assist. The question number 1 A is option A is on the client strong side. Option B is on the client's weak side. Option C is from the behind the client. Option D is with wheelchair. The question correct answer is on the client weak side. Option B. The question number is 25. Which of the following situation is the considered as a international torts? The option A is nurse miscounts and gauze pads during the surgery. The option B is nurse divulges private information about the patient to the media. The option C is nurse causes a burn when the applying a warm soak of the legs. Option D is nurse fail to the monitor blood pressure when the administering the antihypertensive drugs. The correct answer is option B. Is nurse divulged private information about the patient to the media. Question number is 26. When does the nurse charge in interventions that involve in the administrating medication to a client? The option A is before the end of the shift. Option B is before the next dose of the medication or treatment is due. Option C is within 1 hour. The option D is immediately. The option D is immediately. Question number is 27. Which of the following is considered as an indication for administering serum albumin? The option A is clotting of the blood. Option B is formation of the WBCs. The option C is formation of the RBCs. The option D is maintenance of the inocotic pressure. The option D is maintenance of oncotic pressure. The question number is 28. When is the physician telephone to the order a therapy such as the medication for the client as a student nurse who is the best persons to take this telephone order? The option is whoever is the authorized by the hospital policy. The option B is the student nurse giving the client's care. The option C is the student nurse is instructor. The option D is any licensed nurse in the duty. The option E is whoever authorized by the hospital's policy. The question number is 29. It is the appropriate for the nurse aid to the share the information regarding the client status with option A any one of the nurse aid seen fit. Option B is the client's family members. The option C is client's roommates. The option D is the staff on the next shift. The option D is the staff on the next sheet. Thank you for the watching. For more videos, please like and share and subscribe my YouTube channel.